So I'm going to talk just a basic overview on how to afford Esbriet and OFEV, and it's not responding. There we go. So you get this diagnosis of IPF, and while you're trying to digest all of this and understand the disease process, you're told that there are these two medications, Esbriet and OFEV, that give hope for slowing down the progress of your fibrosis. And then you're told that they have an average retail price of $90,000 per year. So that's about $7,500 per month. I'm sorry. My buttons aren't working. Let's see if I can do it this way. Let's see. So I'm going to do it that way. No, that's still not working. Sorry. Sorry, guys. Is that going forward? There we go. Okay. All right. So that's your first thought, right? How does anyone possibly afford that? Well, the fact is that drugs for rare diseases in general have a tendency to be quite expensive. In fact, there's drugs out there that cost anywhere from $350,000 to $800,000 per year. But the fact is that if you can't afford $90,000 per year, then it probably doesn't matter if it's $800,000 a year or $1 million per year, because it's out of your reach, right? I mean, the good news is help is available for most people, whether your situation is you have no access to drug benefits, any insurance right now. You have what we call commercial insurance, which is the non-governmental insurance that we get through our jobs or through our spouse's jobs, or you have a government insurance such as Medicare or Medicaid. And there's many different avenues of getting assistance, and which one you use depends upon what your situation is. So there are private foundations. Y'all probably saw the table out there for PSI Inc. There's another one called HealthWell Foundation. These are foundations that give grants to help people afford their copays. There is the drug manufacturer foundations. In the case of Esbriet, you have the Genentech Access to Care Foundation. In the case of OFEV, you have the BI Cares Foundation Patient Assistance Program. And then for folks with commercial insurance, through jobs, these drug manufacturers also have copay cards, copay programs to help. There are some limitations, though. All of these different programs have different income limits. In general, a good rule of thumb is if your household adjusted gross income is over $150,000 per year, there is a chance that you're not going to be able to find any sort of assistance. However, there can be situations where special circumstances apply. So you might still be eligible to get some help. So don't ever assume, and don't let anybody else tell you to assume, that you're not going to be eligible. If you know that you need some help, go ahead and apply. And before we get into what that process is, I want to let y'all know that each doctor's office can have a little different way of referring you to different programs and the steps you go through. So it's very important at the beginning when you and your physician have made the decision about which drug you want to get started on, and they're going to start you on this process to get it approved for you and get it in your hand, that you get from the person at the doctor's office whose job it is to do this, get the information from them about what the steps are. Get an overview of what steps you should be expecting to go through and what are the time frames. It's always shocking and very upsetting to me when I hear we have patients come to us who might have gotten their IPF diagnosis 6 months ago or 8 months ago, and they're still waiting on medication. Things just sort of drop through the hoops, and we want to make sure that that never happens to anyone. So that's your number one first step, is find out what is the process that they're going to use. So let's say that you don't have any insurance. What happens? Well, your doctor's office is going to refer you directly to the manufacturer's foundation. And the manufacturer's foundation is going to require you to sign some forms, fill out some paperwork. Be sure that you know who it is that's going to be calling you, what you're supposed to fill out, and get that. The quicker you get that information back to them that they need from you, the quicker you'll be able to hopefully get started on medication. So for the vast majority of people, their situation is that they do have some sort of pharmacy benefit insurance. So what happens then? Well, your doctor's office has to file what's called a prior authorization with your insurance company. The good news is that now that these drugs have been out for a while, more and more often, they are automatically approved for folks with a legitimate IPF diagnosis. So if you hear that your prior authorization has been denied by your insurance company, make sure that your doctor's office appeals. I've only seen a couple of appeals in the last several years that we weren't able to win, and that was because of extremely unusual circumstances that are not going to apply to most people. So make sure that that appeal takes place. So in most cases, your insurance will approve. So what happens next? Well, your pulmonologist's office is going to send your prescription to what's called a specialty pharmacy. These medications are handled by a only select group of specialty pharmacies. Now, some doctors' offices may actually have, in the case of Esbriet, a group called the Esbriet Access to Care, Esbriet Access Solutions, may be helping them with this process. So they may actually be giving you a call instead of the specialty pharmacy. Because what the specialty pharmacy is going to do is they're going to file what's called a test claim with your insurance company. And that's where they submit a bill to the insurance company, and the insurance company comes back and says, okay, well, here's the copay that the patient has to pay. Then the specialty pharmacy should contact you and tell you what that copay amount is. What often happens, however, is that people say, I can't afford my copay. I've seen copays from as little as $48 to $4,800 and even higher. What I see very commonly on people who have Medicare and a Part D program is that it has a tendency to be in the $2,000 to $2,400 range. So you're still looking at $24,000 per year for one medicine. And when you're dealing with this disease, you've got a lot of other expenses, right? So $24,000 is still not affordable. So what happens next? Well, the specialty pharmacy will refer you for foundation assistance to either the HealthWell Foundation or to PSI Incorporated if you have government insurance. If you have commercial insurance, they're going to refer you to the manufacturer's copay card program. And one thing I want to make sure that as you're going through the process and folks are calling you and they're telling you these things and they're referring you to other people, make sure and ask them, be clear about who are you that is calling me, what is your role, who exactly do I have to call next? What exactly do I have to do? Because you can end up getting a lot of phone calls from a lot of different people, and it can get really confusing quickly as to where am I in the process and what is going on. So don't hesitate to ask each person you talk to, okay, now who are you? What is your role? What is the next step? how long is this supposed to take before we get to the next step? So what happens if the private foundation denied you because you were over the income limit for them? Well, the next step is that you're going to be referred directly to the manufacturer. The manufacturer's foundations have a different income limit, a different way of determining that than the HealthWell and the PSI do. So you will next be referred to them, and certain steps will need to take place. Your doctor's office will need to verify your prescription. You'll have some paperwork you need to fill out. Fortunately, the process is actually not too bad. A lot of this you can either do online or over the phone. So it can seem overwhelming, but actually it doesn't have to take a long time, and it doesn't have to be overwhelming. So in summary, how does all this go? So if you're uninsured, your doctor's office refers you straight to the drug manufacturer. If you're insured, they file a prior authorization. If it's denied, they appeal it. If your pulmonologist then sends, assuming you get approved for that, your insurance approved, like I said, they usually do, they're going to send that prescription to a specialty pharmacy. Specialty pharmacy is going to get the copay information, give you a call, let you know what that amount is, and then you will decide from there what kind of assistance you need, and they'll refer you to the next step. So what about special situations where you may have a household income that's over $150,000 per year? Well, if you've got some special circumstances, then you might still be eligible. So don't automatically assume you're not going to be eligible because that was your household income. We have lots of cases where somebody's last year tax return may show a much higher amount, but that's because they, say, sold an asset. And that's not going to be the same going on in the future. Or maybe that tax return doesn't really reflect the fact that they have a whole lot of medical expenses going on. You may have a spouse who has really high medical bills. You may be caring for an adult dependent child. So there are different things that they will take into consideration. So ask the manufacturer for special consideration. Write them a letter that explains these things. Now, don't tell them that it's important that you keep sending your grandkids to private school. They're not going to be impressed by that. And if you add all of these things that they don't consider to be absolutely necessary expenses, then you could muddy the water and actually lower your chances of being approved. So focus on things that such as changes in your income going forward, expenses that there's no way that you can change. If your request is denied by the drug manufacturer and you feel like you've got some special circumstances and that they should approve you, then talk to your doctor's office about if it's acceptable to switch to the other medicine, okay? Don't automatically give up being able to receive any medicine whatsoever because you've tried with one manufacturer and not with the other. So talk to your doctor. If it's okay to switch, then switch and give this a try with the other manufacturer. So what can you do to help the process? Already talked about the fact that please do not be shy about making every single person tell you who they are, what they're doing, what the next steps are. If they've explained it in a way that's not clear, make them start over again and do it again. For all of us, from the nurses in the clinics to the specialty pharmacies to the foundations, our job is to serve you and get you on this medicine. And so if we're not doing our job, we need to be held accountable. And if things are taking too long, then we need to be held accountable. So don't be shy about calling, asking questions. Actually, this is one of the biggest problems I see is that people don't respond back. And I know that we're all being plagued by robocalls. We're scared to death to answer our phone unless we know that exactly who it is calling. I get that, we all do. But you need to at least maintain a working voicemail that you check regularly. Because I'll tell you, if it takes too many times for someone to get a hold of you, they either dump your application or they put it back on a big old pile and they don't keep getting to it. And it's just going to cause delays. So be sure and do that. Complete and return any forms they ask you to. Have your things organized together. Have a copy of your most recent tax return. Keep a copy of it to where you can easily get to it. Sign and return those forms. There's often different ways that you can get that paperwork back. Sometimes they'll let you fax it, sometimes they'll let you email it, sometimes you have to send it through the mail. Ask them what your options are and return these things to them in the quickest way possible that's easiest for you to do. And actually these applications and forms aren't too bad to fill out. I've seen a lot of doctor office questionnaires that actually take way more time and are more complicated to fill out than these applications. So go ahead and get them, fill them out, get them back. Keep contact information handy. Know who is the nurse or the case manager or the clinical coordinator or whatever their title is. Who is the person in the doctor's office that does this stuff? What is their name? What is their phone number or their extension? Who is the specialty pharmacy you're referring me to? What is their phone number? Who is this foundation? What is their phone number? Make sure you have all of this contact information. Keep it organized so that you can go back and keep checking with them. Don't sit and wait to hear something. Like I said, I've talked to patients that have, they were told, oh, you can start this medicine, and then they're sitting there months and months later and nothing has happened. Don't sit there and wait. Be proactive, bug people. This is your disease, it's your medicine. So who cares if you call somebody up and they act all irritated because they think you're bugging them? They don't have IPF, so don't worry about that. Don't be shy, don't be overly polite, be proactive. Check in with your provider's office regularly. If you have not heard back, then call them and say, where am I in the process? The same thing goes with the specialty pharmacies, the foundations you've been referred to. Whomever you've been referred to, check in with them and say, okay, what's going on? Where are we in the process? I haven't heard back from you. And again, it's your medicine, so don't be afraid to be a squeaky wheel. And this is just some contact information. I know that y'all can't sit and jot all this down, but the point is that all of this information is available online. So go ahead, Google this stuff, get the information, look at their web pages, have that knowledge. The point is, don't be completely dependent upon others to tell you what to do and what's going on. The other thing I'd like to leave y'all with is that y'all who are here are folks who are obviously very up on managing the disease and being a caregiver who helps manage the disease. Hopefully all y'all participate in some type of support group. I hope you do. We encourage you to do that. And if you do, and if you're experienced at this whole process, if you've gone through this, you know what's going on, please share that information with your fellow patients. As you meet people that have a new diagnosis, please share with them how the process works, what your personal experience was, encouragement to keep going, because what we want to make sure is we don't want any IPF patient out there anywhere to fall through the cracks. And so y'all, as your own patient advocates and caregiver advocates, can help us in the medical profession make sure that that doesn't happen. And anybody have, oh, okay. Well, uh-huh. Mm-hmm. Right, because what has to happen is that prior authorization has to have been submitted and has to have been approved, because the insurance is not going to talk to you about copay because they haven't yet agreed to even let you have the medicine. Here we go.
Okay, no? Is it working? One of the things that is coming up that's going to affect this is whatever this tax change that's coming up through the federal government, for instance, in state tax, not being able to deduct your real estate tax or your state income tax, all of your tax information will possibly change to whatever it's going to end up being. So I have a feeling that there's going to be some fluctuation on what the supports are going to be because of your financial changes, and what you're actually basing it on is your federal income tax. So be aware that this may affect what your co-payments and payments are going to be.
Absolutely, as well as the medical expense deductions that are currently on the table. We just don't know what it's going to look like in the future. And in addition, foundations such as Healthwell and PSI, they get donations every year to fund these co-pays. We have had a foundation that actually went bankrupt and wasn't able to help IPF patients anymore. You do have to reapply to all of these programs every year and start the process over again. And so that picture can be very different. So right now, we don't know what's going forward. We do have, I know that both Genentech and BI have told me on numerous occasions that it's their commitment to make sure that resources remain out there, but we don't know exactly what it's going to look like in the future.